Hello, Twitch. We have returned. It's nice to see you again. I missed you. I cared deeply for you. Here we go. Oh, hello there. This is my favorite part of the show. This is the part of the show where I get to thank you, the ice cream truck drivers. Thank you so much, ice cream truck drivers. Right now, I'd like to thank Coach Rat Bastard, Richard Dunn, and Dead Laszlo. If you want to be an ice cream truck driver just like these fine folks and help deliver that fucking ice cream straight to people's fucking ear holes, head over to preachingfun.com. Preachingfun.com is where you can go to sign up to be an ice cream truck driver, and who knows? The life you save may be your own. And now, a program.
Hey, Johnny, do you want to go to an ice cream social?
Yeah, I'd love to.
Great, let's go.
I cheese grated my finger yesterday, and is that something that you think Dr. Mike could help me out with? Because it hurts like a motherfucker. There's just a hole in my nut.
I hope so.
Dear Liza. Hey, it's Matt Medley's Ice Cream Social. Sitting across from me in Pittsburgh, that's Paul Mattingly.
Across from me in Vegas, that's Mr. Matt Donnelly.
And over there's Jacob the audio guy.
I love that guy. We're preaching fun.
There we go.
Gracious.
There's a cough button.
Now you're
here.
ready to go. Yeah.
There, now I'm ready to go. There we go. I need to open up our post here because we got a lot of questions here from the doc.
Oh,
here.
yeah.
Dr. Mike should be joining us. It is 5 o'clock in the morning his time.
Yes.
So we waited for a double episode day, and that was the most tolerable. We could get him to 5 a.m. instead of 3:30 or 4 a.m.
Right.
And so,
Because he's lazy. He's a lazy doctor.
He's so lazy.
He's here.
No, come on. He's not here yet. It's
He
still
is.
a minute till.
No, he's in the house, y'all.
Let's see. Where are you? Dr. Mike, are you in here?
But I've long wanted to do this episode. He agreed to do something like this a while back.
Yes.
And then this opportunity for the double episode came up, and he was kind enough to agree to be here. And then we also put up a post on our Patreon page, and a bunch of people replied to that post there.
Yes.
I'm excited to bring that all up here. Dr. Mike, are you with us?
I think he is. Here he is.
Unmute yourself.
Sorry, I'm here, gentlemen.
There
How
he
are
is.
Hello.
Wonderful. How are you?
we? I'm good. How are you guys?
First question: does it bother you that there's another influencer named Dr. Mike in America? Does that piss you off all the time?
You know what pisses me off is that he's better looking and more wealthy than I am. That's the thing that gets me.
The second part you might have a point about, but the first part, sir, you're a good-looking gentleman. I just nobody could dispute that.
Yeah.
I appreciate that.
A good-looking doctor. Come on.
Now, Dr. Mike, you want to let's stress your clarifying
credentials.
Clarifying credentials. No. This is not. You are not a doctor giving out medical advice today, right?
Correct. That is correct. I am a professor of physiology. I'm a professor of medicine at a medical program here in Australia. I'm not a medical doctor. I do know how the body works. I do teach medical students about how the body works. So I'm more than happy to help people understand how their body works.
So don't take medical advice from a podcast.
Right.
That's not what we're doing today. We're going to talk about medicine and health and healthcare, and we're going to talk about some specific situations.
Well, this was born of the fact that Dr. Mike has heard us discuss health on the podcast and get a lot wrong. And
when did we ever get anything wrong?
Privately, or someone's just written us concerned about things that we've described on air to
Stop
make sure that we're talking to a medical professional about certain things. He has sent both Paul and I videos on exercises of what we should do to stop certain problems that we were having. He sent us those videos.
Yeah, I would like to start off officially sending an apology to Dr. Mike, because he a couple months ago very kindly reached out to me and see if I was ready to maybe do a little bit of an exercise diet kind of thing. And I said yes. And what I should have said was, God, no, because I wasn't ready. I wasn't ready in any respect to the word, mentally or physically, more mentally, honestly.
Right.
And I apologize for not being more cognizant of where my mental state was and how many hangups I still have about following any kind of dietary restriction or anything. No, it really fucks with
I know
me.
I'm not laughing.
And it
at a distant
no, and
age.
it goes back to my childhood. That it was a big thing. Diet was a big thing in my childhood, and it was fucked up. But I want to say first of all, so I say I'm
This is
sorry
all community
that I
wafers.
wasn't able to follow through, and because you offered me a great amount of help and a ton of stuff, and I just fucked off and
You don't
didn't
need to
do it.
apologize. You don't need
But
to
I
apologize.
but I do feel bad. But on the other side of it, as bad as I feel, I will say that in the last month and a half, my knees have gone insanely arthritic. And so I don't know if I'd even be able to keep up with any kind of exercise program that we'd started in the beginning. So I'll have to modify whatever I'm doing going forward.
I'll
with my
hop in there
crazy
and say
knees.
that Dr. Mike did help me get my fitness back in order, and I still have learned a lot from him after the fact.
Yeah.
And no, the other thing I'll say is that it's less than you think. When he first put me on program, I was like, oh, this actually isn't that crazy. A warm up, 3 exercise where you do 3 rounds,
Right.
and then a cool down, and like you can get that done usually in like 20 minutes to a half hour, and it was unbelievably impactful. And I still, when I get to the gym, still follow his regimen and protocol. He had extra bonus things for like when you're ready, we can really start to go to the next level. But on the very basic, like feeling good about yourself and getting back in, one of the most pleasant things about it was like, oh, this is actually not crazy hard.
Not at all. It's not. It was excellent program, but I'm the
Dr. Mike,
crazy.
how many fat guys do you try to help out a year? How many people do you reach out to? How many?
Yeah, look, I've only got room for 2, and
I'm sitting
Paul,
over here
whenever you're
doing it
ready.
on my own. I didn't realize
I
that 2/3 of the
appreciate
show
that.
were getting
No,
all this help.
We have a fucking
Thank you,
personal
Dr.
trainer,
Mike.
dude.
Thank you. It'll come back around.
Idea what I was missing out on.
Yeah, hopefully I can get my leg strength back in order, and it'll come back around pretty soon.
All right.
consistency is the key. Doesn't have to
Right.
be crazy or intense, but iterative changes over time. That's what we want.
That is the secret, and I've got to get that as part of my schedule.
So, Doctor, before we dive into questions, do you have anything that you just want to kind of lead off with? Do you have anything that you're thinking about?
Look, I'm happy to answer, or at least attempt to answer whatever questions you or people might have.
Literally like a dozen posts just on the Patreon page alone. Let alone, I'm sure once we get going, people in the chat will have some questions here.
Oh, let's do it.
Also, I'm just
Let's
doing
do it.
like middle-aged blood work stuff.
Yeah.
And coming back with, as of like yesterday, the second test confirmed it,
Yeah.
low testosterone.
Oh.
So doing something about that now.
Low T, you need to
Low
get in
T.
that. What's that guy's name? Who's the
Frank
guy? always-
Thomas.
Yeah,
Frank
yeah.
Thomas.
No, me
Big
and
Hurt.
Frank.
Player.
Me and the Big Hurt, yeah. Me and Frank, we're gonna start doing some ads together. It's gonna be very lucrative for me. No, this is my big break.
Well, let's start there. Yeah, low T is a huge. I have a question from someone about menstruation. So we'll start.
Awesome.
We'll start with testosterone and go right to menstruation.
Perfect.
We'll ping pong.
And
it
I
right
just
there.
found out that the same people, the same doctors that deal with this also deal with thyroid stuff, which is also something that's in my family history.
So obviously, there's like a lot of hot words out there. We on Instagram we get targeted for all these crazy products all the time.
Yeah.
What are your feelings, Doc, on how the body works with testosterone, where it should be at with men in their 40s and 50s, and that kind of stuff?
Hormones are tricky because they are chemicals that the body releases as part of communication, and there's cascading events that happen with hormones. So when one hormone gets released, it tends to trigger other hormones to get released, and then there's this cascading event. With testosterone, for example, the testes, that is our primary source of testosterone in the
It's
body.
also where pee is stored, right, Paul?
That's precisely right. P is stored in
That's
the
right.
testes.
That's right. Do not take medical advice from a podcast.
No.
And so as we get older, our testosterone levels diminish. The thing is that everything has a happy, healthy range. There's never like a single value that you need to be at. That includes testosterone. And for testosterone, that's quite a broad range.
It's a big range.
So,
I was surprised at how big the range was.
yes, and everyone's
I'm
different.
still under
So
Yeah.
you might be at the lower level of the quote unquote normal range and still absolutely be fine in every regard. Or you might be at the higher end, for example. But when it comes to going below that range, then the effects can be things associated with mood, with energy levels, with libido. These are
Sleep.
some of the things that can be affected. Sleep with
This
testosterone
is where
as well.
this is where part of this started was trying to figure out sleep
You've been
problems.
having horrible sleep
Oh,
problems.
so bad.
So
It's still
what's
horrible.
your sleep
Yeah.
like? Tell me about your sleep.
Oh, anywhere from, if I'm having a good week, 6 hours a night, and if I'm having a bad week, and it's not always tied to like good and bad things just in life or anything. It's just good sleep, bad sleep week is all I'm talking about. Bad week, I'll go from anywhere from like an hour and a half to 3 hours a night, and I'll do that for like a week and a half or 2 weeks.
You wake up in the middle of the night and you're like awake. Your
Yeah.
body says like you were
That's
up.
the thing, is I can go to sleep.
Yeah.
I can go to sleep and I will be asleep for anywhere from an hour to like 3 to 4 hours. And then I am just awake and as awake as I have ever been in my life.
So when you go, do you go to bed at a consistent time every day?
I try to. Yeah, I try to. It's late, but I try to go to bed pretty consistently.
Because what the evidence is saying now is not necessarily about people stressing about the length of their sleep, but going to bed at the same time every day. It's the sleep consistency that tends to be the bigger tick for our health, as opposed to making sure that we get that length of sleep. So that would be that first thing, is trying to go to bed at a consistent hour. So some of the things include, people try and use alcohol, right? They'll go, okay, alcohol helps me sleep, but then the more alcohol you drink, the actually poorer quality sleep you end up having. And then you pull away from the alcohol, and then your sleep is shit because you're used to using it as a sleep aid.
Right.
So that's something. Eating too close to bed.
I can tell you right now, and this bet does pay, alcohol I know is not the problem.
Oh no!
Because I have cut down my drinking. If I have a drink a week right now, that's a lot.
Wow.
Yeah. And
Who are you?
I know, right? It's insane. Like, I'll still have a few drinks every now and then, but like my drinking has cut down. For new listeners, I've always been a big drinker.
Yeah.
And for just health reasons and getting older and everything else, I've been kind of meaningfully cutting down on my drinking.
Yeah.
So devices before bed, eating not too close to bed. I mean, these are some of the sleep hygiene things that we need to try and get a control of. But outside
I
of
was
that,
told
again,
that a
you're
hot
doing the right
fudge
thing.
sundae helps for the best dreams.
Ooh.
So that's why I've been eating that right before bed every night.
Yeah.
Yes, in bed, preferably.
Oh God.
Hands-free eating challenge.
Can I just quickly say there's a question in the chat by Leon Kassab about testosterone supplements. So over-the-counter testosterone supplements, I'd probably avoid, to be honest, because some of the things that what people don't realize is that a lot of these supplements has to go through the liver first, and sometimes the supplements aren't the best quality, and it can tax the liver. And there's been evidence in the past that people take certain supplements, not necessarily just for trying to boost testosterone, but other things, and it can knock the liver on the head and not be a good thing at all. So I would be very mindful of taking over-the-counter supplements for things like this. You're doing the right thing, getting your bloods done, because there are medically backed interventions that you can do, such as just getting testosterone if required.
I'll tell you.
So I should probably cut back on my gas station estrogen then.
Well, I mean, cut
Little
back.
bit.
Yeah, how much are you taking?
Well, it comes in a bottle.
But the strawberry one's so good.
Yeah, the strawberry one is so tasty. It's just bloop.
So tasty.
Yeah.
Just wait till it comes out as a vape.
No, this doctor my doctor that I was talking to about it, between my first blood test and the confirming blood test, we had an appointment scheduled anyway, and so we were chatting about it, and we did talk about, for other things, supplements. We talked about for vitamin, I forget which one it was, but a slight vitamin deficiency. He was like, yeah, we're just gonna get you on a supplement for this. For testosterone, he did not mention supplements, so I think he agrees with you. I think the doctors unanimously agree on this. Don't do the supplement part, just do the doctor part.
I've been told, so I guess while we're here, I've been told that anaerobic exercise, like weight training and that kind of stuff, can help naturally increase testosterone. Is that true?
Yep, absolutely. I mean, testosterone is an anabolic hormone, so it's there for growth, stimulates, helps support and stimulate growth, along with other hormones like human growth hormone that gets released from our pituitary gland. But yes, if you're going to be in the gym pushing muscles, trying to get them to grow and develop, it can help increase testosterone. Look, if you've got something called hypogonadism, which is
Go
often
on.
the term that's used if that testosterone levels are too low, then the exercise itself may not bring it back into the normal range. But yes, certain types of exercise can help boost.
Okay. All right. Let's go over to let's see. Flindy here writes, we all know people who menstruate are much more prone to iron deficient anemia because of the regular blood loss. I always try to eat foods with high in iron during my period because of it. Fortified cereals, leafy greens, a good steak. Recently, one of my darn children burst my bubble and asked me, since the bleeding is the shedding of the lining of the uterus, wouldn't iron technically be needed when the lining is being built up and not when it's being shed? We both know that's not as simple as iron in, hemoglobin out sort of thing, but overall,
Oh yeah,
it
we
probably
definitely all know that.
doesn't make sense to actually make a difference. But is my comfort steak a lie? Should I be eating it on a different week or at the end of the month or a whole different time entirely? That's from
No,
Flint.
getting that iron in, if required, is just the key. Obviously, when menstruation is occurring and you've got, it's called sloughing is the technical term. When
Stop
when
it.
that when that endometrium is shedding away, the term is sloughing. And yes, you can lose iron through the blood via
That
that
was my
means.
favorite
But
character on Sesame Street.
but it's not about getting that iron back for the endometrium itself. It's about the fact you're just losing blood as a whole from the body as a system. So it doesn't matter when you necessarily get that iron in what period of the menstrual phase, as long as you're able to get that iron back into the body. So it just makes women a little bit more prone to being iron deficient. It doesn't necessarily mean that every woman is iron deficient through menstruation, but it just makes them a little bit more prone.
All right.
Yeah,
But
More
is
prone
there,
to-
is there a good or bad time to having steak, or just is that's the iron in?
Eat
Whenever.
steak when you feel like eating steak.
Have your comfort steak.
Don't let your kid be like the people who didn't believe Big Bird when Slough of Uterus was around there. It's real.
I'm gonna start patting my wife on the shoulder, and be like, "It's slushing time, yeah." And then, and that's when I will pack my things and move to
Slush.
Jacob's house.
Slough,
Yeah,
sloughing.
sloughing.
I don't think my
Sloughing.
house is far enough
Sloughing.
away. I'll be very honest with you.
Sloughing, yeah.
I can't even learn when he just said it. How am I supposed to keep the information in my head for when he's off air?
Slushing time. Let's go get an icy.
Slushing time.
But that is
Time
about
for
that.
you to bleed out of your vagina for a week.
That song is about that in a way.
Yeah.
It's about
Sure.
birth. It's about birth.
I'm just excited that you can still have your comfort steak.
As it
We have
should
a
be.
question here from Big Sexy, who we know a longtime listener,
Yes.
old friend of the show, old friend of ours, and friend of the
Yes.
show.
All
Recently
the
suffered
things.
a stroke, and he said, "Why do muscles still seize and spasm when you have had a stroke?"
Good question. So it depends on where the stroke is. So effectively, a stroke is when a blood vessel, and often we refer to it as in the brain, happening in the brain. If a blood vessel's become blocked or that blood is not getting to the part of the organ that it needs to, and that tissue becomes ischemic, meaning it doesn't get fed, doesn't get oxygen, doesn't get nutrients, and in a way starts to die off, that's what we term a stroke. So a stroke can happen from a clot or a blockage, or it can happen if the blood vessel bursts, right? Which we often call an aneurysm, but again, it can result in a stroke. Depending on where it's affecting. So if we're thinking about, all right, so if I want my brain to tell my muscles to move, the brain has to talk to two neurons. There's a neuron that goes from the brain to my spinal cord, and then a second neuron that goes from my spinal cord to my muscles to tell it to contract. Now, the way I talk about it with my students is that lower motor neuron is what it's called, always wants to tell my muscle to contract. But the upper motor neuron, the first one that goes from the brain to the spinal cord, is telling it to calm down. So when I want my arm to move, the signal comes from my brain, goes down that first motor neuron, tells the second motor neuron, okay, let's move appropriately, and you move. If you have a stroke in a part of the brain that's associated with movement, for example, it can stop that first neuron from playing an inhibitory role, and that second neuron is free to sort of just tell it to contract randomly. So you can get muscles just contracting at random, moving at random, spasming, for example, even
So the
though you may not have
involuntary
conscious
movements-
control.
Yeah, so the involuntary movements stick around.
Yeah, this happens with people's spinal cord injury predominantly. So if you injure the upper motor neuron, the lower motor neuron is intact and can fire that muscle off whenever it wants. And so they end up getting spasms and muscle contractions, which can, be quite odd considering they can't tell that muscle to move consciously.
Right.
But if they damage the lower motor neuron, then that muscle is just full paralysis. It will
Right.
not spasm. It will not do any of those things. So it depends on where it's being affected.
Huh.
Whoa.
I had my neighbor the other day. I was working in the yard and she was yelling across the fence and said, "Oh, my mum's in hospital. They think she's had a stroke." And I said, "Oh, what happened?" And she said, "Oh, we were doing the dishes at her place and I was looking at her face and her bottom lip was sagging on one side of her face, and a bit of drool coming down that side. So almost like one side of her face was paralyzed." And I said, "How was she feeling?" And she said, "Oh, she felt fine." And I said, what about that side of her body? Was that side of her arm and leg, were there any weaknesses or changes?" She said, "No." I said, "Was she slurring her speech?" She said, "No." And I said to her, "Okay, it sounds like," I said, "I don't know what's going on. I haven't seen her, but generally if somebody has a stroke versus this thing, which I think her mother had, which is called Bell's palsy, which is a
Okay.
paralysis of the facial nerve.
Right.
If you have that Bell's palsy, it's just the facial nerve that's paralyzed. So effectively, if you consciously move your face, so you try and wrinkle your forehead, you scrunch your eyebrows, you move your mouth, all those types of things, that's the facial nerve that does that. So if that's paralyzed, then that side of the face just droops. But with a stroke, you also get that side of the face can droop, but it affects other things. So often speech slurring can happen, weakness of some of the limbs or areas below the face. So I said to her, "I think it sounds more like Bell's palsy maybe than a stroke, but let me know. I hope she's okay." And it ended up being Bell's palsy, thankfully, which
Yeah.
is just something that can happen and you can recover from. It just tends to be a virus sometimes can happen and affect that facial nerve.
Oh, interesting. I had no idea that was a
Yeah.
virus. I think I thought
Not
that
always.
was a genetic.
No,
a
not genetic.
thing.
No,
I don't know
Bell's
what I thought that
palsy.
was.
Usually people will have a viral infection, head cold, flu, whatever it might be, COVID, and then it can trigger that facial nerve just to paralyze, and then that one side of the face will droop down.
Huh. Oh, very interesting.
Yeah.
It's wild.
Right.
You want to do a sponsorship real quick?
Oh yeah.
Let's
Absolutely.
do. You know who else thinks Dr. Mike is a very good-looking man, and that's the following sponsor.
Today's show is brought to you by Gatorade's latest collaboration with everyone's favorite beverage, introducing Sprite Thick.
Ooh.
From Scoopy Jess in 2025. That's Sprite Thick.
Hello, this is LeBron James' biggest fan, Joe Smith. I love LeBron James. And if there's one thing I know about LeBron James, he loves a delicious Sprite Thick at the end of a big game. So why don't you be like LeBron James and buy a Sprite Thick? It now comes in convenient
Sprite
scoops.
Thick.
Sprite Thick.
What?
Sprite, not Sprite. Sprite.
Oh, God. Oh, no. I'm in the wrong commercial.
Oh, no. Hello?
Hi, I'm Ted Sprite. I'm looking for my commercial guy.
It's me, Ted. I'm so sorry. I got tricked by this other beverage.
Well, I'm pissed, and I'm going to send you an email about it.
How unprofessional.
How unprofessional. Enter Hey Scoops and check out.
Oh, no.
I'm not over. Dr. Mike, you don't know, Matt recently got an email that started with, "Well, I'm pissed."
And then called me unprofessional.
And I am not over that story just yet.
Yeah. All right. Rakatsdon, I think is how you pronounce it, writes, "What's up with joint swelling? My doctor tells me I have gout. Sounds like a bullshit diagnosis. What causes finger joint swelling? The most my workout fingers get in a day is typing about 2,000 words a day or less on a keyboard, and my fingers and knees do not seem to have any heavy workouts on a regular basis."
Gout isn't a bullshit diagnosis. It can be quite
That's your opinion.
Another
painful.
person in the pocket of big gout talking over there.
Big gap.
big gout, which is often what causes it. So gout is can be extremely painful. Effect they used to call it, what did they used to call it? Like the prince's or king's disease.
Oh yes.
Because of
Right.
the types of
They ate
foods
the
that
rich
can
food.
induce.
Mhm.
Yes, exactly right. So anything that can produce high amounts of uric acid, which can be proteins, foods high in protein, but also like tomatoes, things like that. It produces uric acid, which your body needs to excrete. But for people with gout, they can't excrete it appropriately. So it accumulates in the joints and then they form crystals. And even though they're microscopic crystals, when you move those joints, the pain is horrendous. So the treatment for gout is a combination of dietary intervention, but also a pharmacological drug intervention, which helps reduce the amount of those uric crystals.
So gout is about being predisposed to it. So
Yes, so often it is a predisposition.
So if
Yeah.
someone is not predisposed to getting gout, can they get it?
In biology, I would never say never, but
Sure.
there would be, I'm confident that there would be people who aren't predisposed and they could probably eat as much of this as they want and they won't get it. And there's others
liver
who
all
just
day, every
eat
day.
and they just eat a little bit more than other people and they get it. So it's sort of, everyone's a bit different.
What about, I know that people are working on all the kind of genetic testings and figuring out what you're predisposed for. What's your thoughts on those types of things and getting those types of tests run on yourself and kind of figuring all that stuff out? And is that something that is worthwhile doing at this point, or is the technology there yet? How are we doing on that?
The technology for the screening is there, but it's then how useful is that information? So if you find out that you've got a mutation or a genetic change that predisposes you to something and there's nothing you can do about it, I'm not sure how useful that is and how stress-inducing that might be for you. So it's a conversation that you'd need to have, obviously, with your GP, just to see, okay, well, if there's an intervention that can be had that could benefit me, then it might be worth it. But also, it depends on what you're testing for.
Should he lead with "this sounds like a bullshit diagnosis"?
Hey, go to the doctor, sound skeptical. They need to convince you then. Look, I think one of the things that doesn't happen enough is people self-advocating when they go to their doctor. I talk to people all the time and they go, well, this is a doctor. They're an expert. They know it all. If you are uncomfortable, unsure, don't believe them, or importantly, don't understand them, push them. Keep pushing them. Say, that doesn't make sense to me. Explain that better. I don't know what that means. Justify to me why you think that is my diagnosis. Don't just say it. What's the evidence for it? People need to do that more often.
Mm-hmm.
What about asking ChatGPT?
That's a trickier one because the output of ChatGPT isn't a bad diagnostician, but people are bad at knowing their symptoms and prompting ChatGPT. So,
What do
for
you mean
example,
people are bad at knowing their symptoms?
So people might go, oh, God, I'm hot. I've got a fever. I've got this pain. I've got this rash. But there's certain words that we use to describe certain rashes. A fever isn't just feeling hot. So people use the wrong words to describe what they have.
I see.
ChatGPT is a literalist. It will only work off the specific information that it's been given.
You told
and
me you have a
therefore-
fever, so I'm computing that you have a fever. Yeah.
So it's going to go through everything. Yeah. So it's very much as good as the prompt is. And it can be a really good diagnostician, but again, you don't know what you don't know.
Yeah.
So I would be reluctant. I'm not saying don't use ChatGPT, but I would be very reluctant in its output and trusting its output. What will happen in the future, we train our doctors at the moment that your patients are going to come in with an LLM readout. They're going to say, I typed my symptoms into ChatGPT. This is what it said. You need to be able to interpret what GPT is saying to your patient and sort of, bridge the gap. So we do that with our students.
Oh, wow. So you're preparing for
Right, it's a modern world. You gotta
even
do with
past
it. Yeah,
WebMD. You're preparing for the AI interface stuff now.
Absolutely. I mean, our
actually-
students use AI in a lot of the stuff that they're doing.
That's how my mother-in-law advocates for herself.
Uh-huh.
She says, if you don't tell me what's going on and how I'm going to do it and what the plan is, I'm going to go on the internet and ask the internet.
That's
for
a
all the
good
answers.
move.
That's what
I
she
like that
says.
move a lot.
She tells all of her doctors, I'll just go home and go on the internet.
Yeah.
And so you got to tell me now or I'm just going to answer this at home.
I adore
And that-
your mother-in-law.
She's
I love
great.
her. I
It's a
love her
very-
so much.
It's a very effective tactic.
She's wonderful. And she's good at
It
life.
is effective. There's the amount of even just friends that I talk to who aren't in the medical or health industry that have seen a doctor, and I'll talk to them and go, oh, what did the doctor say? And they go, I didn't really understand what he said, something about this, or I didn't understand what she said, something about this. And I'm like, why didn't you ask them to clarify? This is your health. Clarify. If you didn't understand it, that's on them. It's their job
we
to make
bluff
sense.
all the time where we say, no, I get that.
Sure,
Well,
sure.
Sure, I've read that book, and yes, I've seen that movie.
Yeah.
We bluff all the time.
I mean, the number of things that we've just agreed with on this show that we were proven wrong about within like the next 10 seconds. Where we're just yes-anding each other and we go, oh, yeah, yeah.
But I appreciate what Dr. Mike is saying. Is that
Yes.
knowing that we're all like that.
Yeah.
You can be a better advocate for yourself.
And OG Scoop said a few minutes ago in the chat, he said the American healthcare system really depends on patient advocacy. Because and I think he's right. The more I'm thinking about it,
Self-advocacy, yeah.
Self-advocacy. Yes, self-advocacy of the patient. Yeah. And I think he's absolutely right because I mean those checks aren't built into the American healthcare system, especially.
No, we had friends who just had a baby and they
Yeah.
had a nightmare story of everything. Like the doctor came in and said, like, well, if this doesn't happen by blank o'clock, we're going to do a C-section. And they had to have an advocate with them who was a doula who was like, why? What? I need to know the reasons why.
Yeah.
And it can't be just that it needs to be done in 20 minutes. So like,
Yeah. It
what
can't
are
be
the
you
other
have an
reasons?
appointment. Yeah.
It was a really strange experience for them, and it was
bet.
very intimidating. All right, Captain James T. Scoop here. Actually, it's a couple questions, but I'll start with the second one. My mom began perimenopause when she was about 38, and now I'm 36. I'm starting to experience some symptoms. Are there any genetic or inherited factors that contribute to when you start to experience perimenopause? Is there any research on the topic? And thank you. And I'm bringing that up because I feel like we haven't heard about perimenopause in a very big way. And now recently it feels like people are starting to really talk about it.
Sure.
There's also a lot of talk about there being lax research for women-centric medical issues.
Sure.
So I'm curious about all of that.
Always.
Yeah. I did a video on my YouTube channel recently on covering menopause, perimenopause, and post-menopause, which sort of goes through all the different... So if you want a more detailed look at it, feel free to just type in perimenopause Dr. Mike into YouTube, and I go into a lot more detail. But effectively, it's the hormone changes that are occurring. And so basically, when you are born as a female, actually before that, in utero, when you are in utero, you've got 7 million oocytes or eggs inside your own ovaries. And that's when you are inside of your own mother's womb. And then when you're born, that's
sounds like too many
7
eggs.
million. Well, that's what the body
I don't
thinks
really
as
eat
well.
that many
because
eggs.
by the time you hit puberty, it's dropped down to around about 700,000 odd. And then by the time you hit perimenopause, let's say around about late 30s, early 40s, that's dropping down to 1,000, maybe less, right? And then by the time menopause hits, menopause is defined as not having a menstrual period for greater than a period of 12 months. And that's an indication that there are not enough oocytes or eggs to ovulate. And then what goes along with that are the hormonal changes, because if there's no eggs to ovulate, then the hormones that regulate that, which is estrogen and progesterone, they start to tweak and play around. And so the symptoms that present through perimenopause and menopause are a result of the estrogen and progesterone levels tweaking themselves. And so some of those effects can be things like hot flashes, changes in libido, in desire, in regards to the desire to do something, so energy, fatigue, things like that. When it comes to, there is a lot more research going on in it. As a genetic predisposition sort of thing, well, all women will be going through this at various stages. So there would definitively be some genetic association with it, so heritable. But again, it depends on when those oocytes or eggs are getting exhausted, when they're all getting used up, at what point in a woman's life that happens. And it's going to be slightly different for everybody.
So, but genetics can be a factor, is what yours is part of what you're saying.
Yeah, definitively would be.
Yeah.
Any other big factors, like anything else where you're at, diet, anything?
No, not really.
It's just kind of happen how it happens.
Switching to oat milk at too early an age, does that?
It's because those eggs, from being in utero, well, around about from birth, those eggs are undergoing a cycle of where they think that they're about to develop, and then they die off. And hundreds of them die off all the time. Die until puberty hits, and then one of them doesn't die every month, while the rest of them continue to die. So it's just this cycle that's happening from birth all the way up. So this is why hundreds and hundreds of eggs just keep dying off. And we start with 7 million and then end up exhausting that to under 1,000 by the time you hit around about 40, late 40s, mid 40s sort of thing.
It sounds like you're saying it's almost like more of a burden to be a woman than a man in the world, and in which
That
case,
can't be right.
We thank you for your time. Thank you,
Dr.
so
Mike.
much. We can,
I want to know, Dr. Mike. I have just recently seen
At least everything's cheaper, though.
There's been some research. I don't know how much of this you put any credence in or what you know about it, but I've been seeing some research about how there is so much going on in utero with the development of the ovum and all that kind of thing, that there is some theoretical science out there that is talking about how much trauma suffered by the mother can be transferred to the fetus, and specifically to the eggs of the fetus, that can then travel on for generations. Have you heard anything about this kind of stuff?
When it comes to things like trauma, I don't know enough about that getting imprinted, but there are other things that can get imprinted epigenetic. So you can have what's called genetic changes, where the DNA, which is made up of 4 letters, A's, C's, T's, and G's, right? They can be changed. So mutations can happen where a C turns to an A, for example, or a G to a T, or whatever. So that's called a mutation or a SNP when those changes occur. And that can change the way you make proteins or look, act, express. But then there's things called epigenetic changes, which means upon the DNA. And this is things like methylation, where chemicals actually sit on the DNA and make it harder or easier to read the DNA. And that has been shown to happen and can present across generations.
Wow.
So for example, there's a study, and I'll probably get aspects of this wrong because I'm just working off memory, but there was a study where there was a potato famine in Holland, I think, in which basically the nutrients were diminished for a population, and that led to epigenetic changes in which the next generation, that those children were smaller because there were fewer nutrients. Then that second generation got enough nutrients, but their next generation were also smaller, even though the nutrients were sufficient because of the epigenetic changes that had happened on that population.
Oh, so the survival element of it was overpowering the circumstances.
Yeah, so yes.
It basically made a change and didn't have a reason to change back, even though it had enough material to change.
Yes. Yes. So the
Huh,
pressure,
That's really
the
interesting.
evolutionary
Yeah.
pressure, yeah, sort of tweaked on it. Yeah.
Mm-hmm.
Huh.
All right. James, Captain James also says, "Are there any trends in the medical community that you are excited about? And conversely, are there any that you are wary of?"
It was the Rocky Horror Picture Show Scooperty. It's being passed around in medical circles now, and
I was
it's
very
it's-
wary of it. I'd
Yeah,
be very
I'm
wary
excited
of it.
about it.
Excited is the CRISPR-Cas9 type of DNA editing that's happening.
Yes.
That is extremely exciting. So I am of the personal belief that all genetic diseases will be not anything we will worry about within the next generation.
Wow.
I'm pretty confident about, and the thing is that cancer is a genetic disease. So cancer can only happen if there are changes to the DNA. So regardless of all the things that cause cancer, all roads lead to Rome, and Rome in this instance is genetic changes and mutations. What this CRISPR-Cas9 can do is can go in with a pair of molecular scissors and chop out the change and fix it. That's great when it comes to kids who are born with genetic diseases, because then you can go and chop it and change it because you know it's happening. But then when a cancer occurs, it's harder because you've got to go, oh, you got to wait for the cancer to occur, then see what tissue and then do it. So it's trickier, but I do think that the CRISPR-Cas9 technology will cure many cancers, and we'll be able to get rid of a whole bunch of genetic diseases. When it comes to things that I'm wary of, the main thing that I'm wary of at the moment is how many black market supplements, and not even black market, just supplements that are available.
Just gas station supplements.
Shit like
If you're,
that.
if you're trying to take away my strawberry estrogen vape right now, I'm gonna be so mad.
When I was at the doctor the other day, the nurse comes in and she's like asking all of the pre-questions and everything and doing the blood pressure check and doing all this stuff. And she goes, "Are you on any medications that we don't know about?" And I said, "Nope." And she goes, "What about any supplements?" I say, "Well, once a week I do walk into 7-Eleven. I pick one of the little baggies of pills off the counter and I just take it." She 100% believed me.
Dude. Well,
She just looked at me and was like, "Is that something you actually do? You shouldn't."
you can't be joking with the doctor. You can't be joking. No, but that's an epidemic out here right now. What are your thoughts on that kratom substance?
Oh, I haven't heard of kratom. What's kratom?
What is this, Paul?
Oh, so kratom is this new truck stop meth stuff, kind of. I don't know exactly. It's okay. So
Everybody drink. Paul brought up something he doesn't know about.
no, I did. James T. Scoop is saying it mimics painkillers, and it does. Like I've heard that there are people who swear by it. They say it changed their life for the better.
Plant-based substance frequently sold at convenience stores, truck stops, and vape shops. Highly potent extracts and synthetic derivatives like 7-hydromidodranzine, that's 7-OH, can trigger opioid-like effects and severe dependency. Because of this, it is actively targeted by regulators and banned in multiple states.
Yeah. It's a
So,
very...
Dr. Mike, what do you think of that?
Well, that
Pop
I mean,
quiz,
as
Dr.
soon as you
Mike.
said, if you preface
Severe
the drug with
dependency?
truck stop,
Yeah.
I'm not overly stoked with it.
Right.
I like that
Yeah.
severe dependency is listed in there.
That's just
Well,
it. I mean,
also because truck driving is a rough job.
Yeah.
Right? It's a rough
Sure.
job on the
Oh, yeah.
body, and you're by yourself, and you're just looking for probably some help.
That's it.
God,
But
yeah,
that
that's
is,
Yeah,
fun.
no, it's definitely it's a weirdly targeted, I think, market of people, like a niche market of people that don't get a lot of help.
I read an article
cousin
about
was a
the
truck
CRISPR
driver.
gene. CRISPR was going after the gene that makes cholesterol. Basically, like instead of using statins, that it might be just stopping your genetic input to like create it in the first place.
My recent
Yeah,
doctor
I
visits.
think there's going
a
to
big-
be a whole range of ways that the CRISPR-Cas9 and those types of technologies will be used. The
Yeah.
tricky thing with it is that if you do it prior to birth, so for example, if you know who the parents are going to be and you're able to screen, let's just say, the developing embryo, as it's just a few cells, right? Let's say it's a few cells growing and developing. You can then screen the DNA there because that DNA is going to be the DNA of the adult, right? So you can screen it and go, oh, there's a mutation there. You can then treat it a lot easier because there's fewer cells that you need to change the DNA because your DNA is in every cell of your body except your red blood cells has the exact same DNA in it. So all the cells effectively need to be tweaked. Once you're born, it's a lot more difficult because now you might need to treat all the cells in your body somehow or very specific tissues. So that's the difficulty that they're having is targeting specific tissues. But they're looking at it with, sickle cell anemia, certain types of childhood cancers, cholesterol, trying to tweak the way we carry LDLs and things like that and cholesterol and so forth. So yes, it's exciting.
Yeah. When I was talking to my doctor the other day, he actually mentioned that he wanted to set up some genetic testing, some genetic screening. We were talking mainly about cancer screening, but yeah, we talked about like family history and things like that. He's like, oh yeah, I want to set up some genetic stuff. And he mentioned specifically CRISPR. He was talking specifically about how exciting some of the developments were there. Yeah,
it's very cool.
Whole new world.
Let me add, the genetic testing is different to that. What's it, 23andMe type of
good call.
Family history. I don't think anybody should do. I don't think anybody should do that 23andMe style testing for a number of reasons. First of which is that they will. I'm quite confident that at some point, if they don't do it now, they will do it at some point, sell your genetic information off. And
that's already been a problem with one of the big ones. The company, it went out of business, and another company came along and bought all of the data.
So
I mean, like that has already happened.
Not great.
Which brings up a question from Emma and Tonka the pony. Says, how much validity/reliability is there to DNA tests that are used to create personalized supplements or vitamins to help kind of fill in the gaps?
That's a trickier one because if you're using DNA testing or genetic testing to see what supplements you need, the question then is, what information are you getting from that genetic testing? So, for example, if I want to know, or if you about myself, if I go to my GP and I go, I'll do a blood test, I want to know what my levels of let's say vitamin B, let's say vitamin D, E, K, A, and it comes back, and my GP says, oh yeah, you're deficient in vitamin D, for example. That really is not a piece of information that I can get from a genetic test. I can do a blood test and it can tell me about my vitamin D levels. So what is happening, and there's some validity to it, there's also some crap to it, is that people are going, oh, you've got this small genetic change, which means you metabolize this thing slightly differently, so you should now take this particular supplement. It depends on what it is they're talking about. There's some evidence for some of those things, and there's crappy evidence for others. So
at the very least, there's some level of hooey involved in there.
At the moment, when it comes to doing genetic testing for certain types of supplements, yes.
Gotcha.
But again, have the conversation with your GP, and your GP should be able to tell you which ones are the bullshit ones and which ones are ones that might be able to help you. But your GP should, when you go and see them, they'll say, we're going to do a blood test for this and we'll do a genetic test for this. But there's clinics popping up where they're like, oh, pay us X amount of money and we'll do every test possible. That can be an issue. It's like when, I think it was Kim Kardashian advertising, you just go in and get an MRI done. Oh, you've got no issues, but come in and get an MRI done and we'll pick something up that you might not know about. That can be actually a problem because we've all got abnormalities in one way or another, which can be harmless. They're not necessarily pathological or issues.
Got it.
And then you might do a screening and go, oh, I've seen this in your body. Let's do something about it. It's not an issue for you. It might not ever be an issue for you. And now they're going to do medical interventions on something that's not a problem. That can be Yeah. So the
That reminds me
psychological
of the
stress, the cost.
yep, the Dead Kennedys classic "Trust Your Mechanic." That's the song about you go in for one thing and then they end up with another whole thing and another whole thing, and it's all
Yeah.
about mm-hmm.
This is
Before
why
we
that
move
self-advocacy is important.
Yes.
Oh, sure. There you go. Before we move off of the genetic stuff, the mail-in testing, all of the ancestry stuff and everything, other than them selling off the data, which is not good at all, how much credence, the people that do get those done, like how much credence should people put in those?
So let's just say you do that test and it comes back and says, oh, you're 50% Irish,
Right.
right? The question is, at what point in your lineage, because we're all related to each other, you go back far enough,
Right, Adam and
you'll
Eve,
go
yeah.
back to the
Adam and Eve. This fucking
Right, that's where
guy.
you're going, right? You're going back to 6,000 years ago, Adam and Eve.
Am I genetically predisposed to burying bones deep in the thing so that people think we existed even longer before?
That's right.
You know what I mean?
Yeah. Am I genetically predisposed to
testing other
believing that
people's
these are
faith.
dinosaur bones and not just tricks of the devil?
But if you go back, it depends on how far you go back. You can go back to your first ancestors, like you said, Adam and Eve,
Thank you.
that's where we're all from. So when they say you're 50% Irish, at what point in your history? You could say we are all, I mean, all of us
Explain that to me.
genetically.
So if you are, so let's say it comes back and says you're 50% Irish.
Yeah.
Why does it matter where in the ancestry timeline? Why does that make a difference?
Because it doesn't mean anything. Because, so for example, if you go back, go back 2 generations, right? So I go back 1 generation, 2 people are responsible for me being alive. I go back 2 generations, it's going to double, right? It's going to be 4 people responsible for me being alive. Go back 3 generations, 8. Because that exponential growth, as soon as you go back something like 100 generations to the time of, let's say, the ancient Romans, right? There's going to be more, statistically or mathematically, there's going to be more people responsible for you being alive than have ever existed, ever possibly have existed. So the maths doesn't add up, right? And so the question, because it just doubles, right? The number gets so
because
big.
there's overlap that we're not counting on. There's overlap
'Cause we're
between
all
people
inbred.
that we're not. Yes.
My
I see what you
cousin
mean.
jumps
I was
back
literally
into
sitting
my
here
tree.
thinking, oh, he's not giving enough credit to people being inbred in this
Yes.
math as he's taking it out. But yeah, that's exactly where you're going.
People that have appeared in your family tree once will appear again multiple times. And so what that basically tells you is you can do the statistics. If you
never
go
thought
back
of it
far
that
enough,
That's
way.
so weird.
Yeah.
if you go back
Yes.
far enough, you can find, so let's say you go back, you could go back, I think it's even as early as 10,000 years, right? Or no, I think it's even 5,000 years. I'm not getting the numbers right, but it's not that long ago. You can go back to find a certain point, and that person will be related to all of us, because they're going to have a descendant who will jump into our family tree, right? So,
So the percentages aren't taking into it. So the percentages are blood percentage, but it's not a direct transferable number to a number of people.
Yes. So if you were just to
So like
do
if it
the
says
math
50,
on,
so if it says I'm 50% Irish, it's not that 50% of my ancestors are Irish.
no, it
Right.
says that it takes one part of your DNA and says that, oh, okay, there is a certain stretch in your DNA that corresponds with all the other people that we've tested around the world. 50% of them also have that, and they've had a history in Ireland, is all that's saying,
Well,
right?
all right.
So again, what does that mean? How useful
So it
is
comes
that?
down to we just don't know how to read these test results. We don't understand enough
We're
about these
fascinated
test
with
results.
stories.
Yes.
We want to hear that we want to
That's
hear
what
where
it is.
ancestors lived, and
Yeah.
we want to feel like we carry a certain element of culture with us, but it has nothing to do with our actual genetics or health. We just want to know that we're related to Abraham Lincoln.
That's it. Yeah.
But the thing is, we are
Or
all
I can wear this
related
piece of
to.
clothing without being called racist. I can show up in a kimono and be fine.
Yeah.
No, it's fine. I did the test.
Yeah.
Right.
So yeah, you could pick your favorite Egyptian pharaoh, and you will be related to them. Like you will statistically be related to them. There will be genetic material that you have
Ramses
that they
the
also.
second.
Oh, dibs on Tut.
Yep.
Dibs on
So again,
Tut.
it doesn't matter. Dibs on Tut.
Wow.
I think I read that Cleopatra. Actually, speaking of inbreeding, I think she has like half the number of great grandparents that she's supposed to have.
Oh,
No,
that's a tough one.
yeah. So she moved it along a lot faster than even Dr. Mike's talking about, which is convenient.
But yeah, but looking at these tests again, it is just kind of, it's just another way to nefariously put some kind of value system on essentially the only real differentiating factor in a lot of this is how much sun exposure did people have in the area they grew up. Like it's just what effect did solar radiation have on the melatonin you produced? That's really all we're fucking around with here, right? Like,
Yeah.
it's
Yeah.
and it's not really, it's
As
not
far
having
as I know,
anything to
sure.
state about the difference of how you are genetically, so much as just how much sun were you exposed to, whether or not you had cloud cover in where you grew up. Or
I
where
think
you're,
Matt's right. I think we just want the stories out of it.
Yeah.
No, you're
From
absolutely right.
Kenny.
That's absolutely it.
Dr. Mike, I'm turning 40 on July 15th, and I'm a first-time father with a 4-month-old daughter. Every day
Nice.
I take
Congratulations.
handfuls of supplements, including vitamins, multi, B, C, and D, fish oil, turmeric, magnesium, fiber capsules, CoQ10, and a prebiotic. I also take creatine, although I haven't had as much time to work out lately. I've been taking it less regularly. I guess the question is this shit doing anything for me? Anything I'm missing? Anything I should forget about? What supplements are worth taking as a 40-year-old dude?
I don't know. Stop taking all of them and see what happens. Go cold turkey on all of them. See
Go
what goes
cold
on.
turkey and just get kratom.
Yeah. Do not take medical advice from a podcast. It's stupid. We're dumb people.
Yes. Well, congrats. I'm turning 40 soon too. So it is a exciting time in your life when everything turns to shit, basically, right?
Yeah.
Yep.
50's even more fun.
Oh, don't say that. Don't say that. It's amazing because I'm hitting 40 and psychologically I still feel 19, and then I'll go into the gym. And I go to the gym at work, right, at a university. So when I go to the gym, it's filled with 18, 19-year-olds. And I walk in and I'm like, I'm as fit and strong as these people. And then I will leave with an injury every time, tweaked back. There was one time, it's embarrassing. I went in the gym and I went, I'm not going to go heavy. I'm just going to lift and move. And then I saw these guys obviously trying to lift their heaviest with a deadlift.
Right.
And I'm like, okay, I think I could lift more than that. And so I just went in and I lifted this weight and my back just went ting and I collapsed on the floor.
Oh,
Collapsed onto the floor.
I would not have bet that Dr. Mike would have been the guy that goes in and has to match.
Oh, I'm the guy.
I would have lost that.
I've got a psychological issue there.
Yeah.
Hey, fellow teenagers, you guys know who's selling drugs around here? I'll do some deadlifts.
That's me. So to the question, all those supplements, look, some might be helping you. Most probably aren't. But what's been missed out is probably the big ticket items, which is the sleep consistency, the diet, the exercise. Like this is the thing that really shits me is there are all these health podcasts out there. And I have a health podcast, but there are all these health podcasts out
Plug
there.
it. What's the name of that podcast?
It's very boring. Dr. Matt and Dr. Mike's medical podcast.
Easy to remember.
But they will talk for hours on how you can, what protocols you can do and how you can tweak your health and all. And effectively, the podcast should go for 5 minutes, and it's about sleep consistency, balanced diet, and regular exercise. It's the boring shit that will make up for 90% of your health. Unfortunately, it's just what it is.
Now,
Right.
Cheerios just added protein to one of their brands of Cheerios. How much is that going to change the world and help everything?
If only my son loves Cheerios. If only it would. All these things are adding protein. You have a look. Have a look at the packet of the original and the old, and you'll see that that difference is so minimal. Yeah, marketing schemes, marketing ploys. We probably all do need to add a little bit more. Well, I shouldn't say all, but a lot of us probably need to prioritize protein, is how I should say it, for a number of reasons. One is that it satiates you more so than carbohydrates tend to. So if you prioritize your protein in your meal and you eat that, then you're going to be less inclined to eat more of the, quote unquote, crappier foods afterwards. So if you're just eating the carbohydrate based foods, the brain loves sugar. You're never going to get sick of sugar. Doesn't matter what happens in your life. We have evolved that brain goes sugar, 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 yum, yum, yum. So you can eat a lot more of it than you necessarily need. But with protein, take that in first, satiate yourself. You'll be generally less likely to overindulge on those others.
Original Cheerios had 5 grams of protein per actual standard serving size, not their recommended serving size, but the amount of food that most people actually eat. About 5 grams of protein for that size. The new revamped Cheerios has 8. They've gone from 5 to 8.
Well, there we go. Problem solved.
We're all set, people. Thank you, Nabisco.
Arnold
I don't know
Schwarzenegger
who
was
else
doing.
Cheerios. Ratcat's down and asks, why are blood pressure machines and meters such shit? And does blood pressure meds, different blood pressure meds make me sick? Others have odd side effects. I guess the general question is how to control blood pressure.
Look, that's a really good question. Blood pressure is a tricky one. Hypertension, which is elevated blood pressure for long periods of time, is the silent killer. It is one of the biggest factors that predisposes, excuse me, one of the biggest factors that predisposes us to early mortality is high blood pressure, increases stroke, metabolic disease, heart disease, things like that. But you don't know that you've got high blood pressure until you get it measured often. So if we just rely on going to the doctors to get our blood pressure measured, that's fine. But there's something called white coat syndrome, which I think a lot of people have heard of, where when you go to the doctor, you're a little bit anxious, a little bit stressed, your blood pressure is going to go up. And so it might be a little bit of an artificial reading. With the at-home blood pressure cuffs, they may not be as accurate as those in the clinic, but they've shown to be really good prognostically because one, you use them more consistently, and two, you're in a more relaxed, comfortable, quote unquote, normal environment. Where they become shit is that they're not getting used properly. So for example, the cuff, if the cuff's too big or too small, that could be a big problem. If you're not putting it on the arm properly, if you're not holding the arm at the appropriately, if you're using the wrist ones, they're going to be less accurate. There's a whole, but if you've just finished exercise, if your legs are crossed, if you're sitting versus standing, all these things are going to tweak that blood pressure outcome on those tests.
That's just cutting home to me as someone with long term who's been on blood pressure meds for a very long time.
Yeah. So the meds help. The meds are life saving, and I know that some of them can come with side effects. I mean, all drugs have some degree of side effects that can occur, and blood pressure drugs are not excluded from that list. So it's about having a conversation with your GP about, sometimes you just got to figure out what is the right combination. Often they don't just use one blood pressure med, they often use 2 together now as the gold standard treatment. And you've got to find those that are best for you, side effect wise, but also in the way that it manages your blood pressure.
You know who else is going to name their new improv group possible side effects based on blood pressure medication side effects? The following sponsor.
Was my improv. Today's show is brought to you by Protein Puree brand meat oatmeal. Now with more protein. That's Protein Puree brand meat oatmeal from 2021 Night Scoops. They were ahead of the curve.
They really were.
Mm-hmm. Hi, I'm Carl Sagan. A long time ago, I told you about the billions and billions of stars. Today, I'd like to tell you about the billions and billions of pieces of rolled oats. Rolled oats that are now being replaced with chunks of meat. Delicious chunks of meat. Tonight, when you go home to prepare your overnight oats, throw them out. And instead, just pour a bunch of hamburger in a bowl, a little milk and some yogurt, stir it up well, and set it in the fridge for 8 to 12 hours. When you wake up, eat that first thing in the morning. Good luck.
Meat meal.
Enter Hey Scoops at checkout.
I think that would be very damaging.
Probably. I mean, sure. I agree, Paul.
Uncooked hamburger and milk and yogurt? Yeah. it'd be bad.
Here's a random one. Do Kegel exercises improve erectile dysfunction?
Not for me.
Or just improve erectile functions?
I don't know.
Okay. That's fair.
I think it depends on the cause of the erectile dysfunction. It's not a single cause. There can be anatomical issues, there could be psychological, there could be physiological. And so I wouldn't be able to answer that question, unfortunately.
Okay.
But strengthening your pelvic floor is a good thing to do generally. And one of the big things that are coming out at the moment is that hemorrhoids, we may have spoken about this last time. I bring hemorrhoids up with you all the time. Hemorrhoids can be benefited with having a stronger pelvic floor.
Oh.
Okay.
So in other words, couldn't hurt.
Couldn't hurt.
Okay.
Okay.
What are some little known things that both men and women can know or consider when trying to get pregnant, especially like ahead of time? You want to start planning a pregnancy. What are things to start to consider?
Oh, like heads up that people don't really think about?
Yeah.
Yeah, awesome.
Well, that's a tricky question. If we're talking about, anatomically, physiologically, everyone is different. The way that the menstrual cycle needs the stage that the menstrual cycle needs to be in, like your window for pregnancy is quite a narrow window. It's only around about 5 or so days, either side of ovulation, which is around about day 14 of the menstrual cycle. But you've got to, heaps of things need to be considered, which you can't really do unless you specifically go in for testing, such as sperm count and quality, when the menstrual cycle is occurring. I would say, as a father myself, the biggest thing to keep in mind is the things that you don't know are going to happen as a parent when you have a child, which is how stressful and beautiful kids are. I always tell people that having kids are the best shit thing I've ever done. That's how I describe
That's great.
it.
That's fair.
I've never slept worse. I've never eaten worse. I've never exercised less in my life. I've never stressed as much in my entire life, and I wouldn't change it for a second. So it's very interesting. But yeah.
What about health? What about health things for newborn kids that people might not know about?
Well, the things that people need to do. So there's been reports now of people, for example, not. So when a baby's born, often they'll get a vitamin K injection.
Okay.
And the reason why they do that. So vitamin K is important for clotting. So if our liver makes these clotting factors so that if you get cut, you don't bleed out, right? But the thing is, a lot of babies don't have enough vitamin K, which means if they get cut, they're at an increased risk of bleeding out. So what doctors will do is they'll give them a vitamin K injection as a just in case something happens that they need to clot, they can do it. And a lot of people
one of those cases that, like, when they changed this practice in medicine, it like got rid of childhood mortality rates, like it vastly changed something, and this is just one of those things that we never heard about.
Yes, it's exactly right, because people don't see the repercussions of not doing it, because we often do it. People are, why are they doing this? Well, this is pointless. I don't want to give a jab to my baby. My baby's only just been born.
Right.
Yeah, but you don't realize that historically, if something had happened and that baby were to bleed out, that's one of the most horrific things that could occur.
Sure.
And
babies don't die by the millions from preventable diseases. Why should my child get vaccinations? They don't die because of the vaccinations. Yeah.
Oh, it kills me. It honest to God.
Not you, but it does kill those babies.
Yes, it does.
I had a conversation. So I I play tennis every Thursday night, and there's
Sorry.
a person that I play tennis with. There's a person I play tennis with who's a mechanic and is a good friend of mine, but he argues with me all the time about vaccines,
Oh my
right?
goodness.
And
I love non-experts arguing with experts. It's my favorite thing.
and he'll continually ask me questions, and then I give him the evidence-based answer, and then
Sure.
he'll dismiss it and say, no, 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 no. And I say to him, I'm like, mate, do you realize that what you're doing to me right now is if I walked in to your mechanics and you were, I don't know, changing a carburetor. I don't know what a carburetor is. You were changing a
It's
carburetor, and
something
I
that needs
walked up and I
changing, is
said,
what it is.
and I go, mate, that's not what you do. You don't take that out. That's ridiculous. Leave that in there. You gotta put something else in there. I said, how would you talk to me if I came into your workshop and did that? He said, I'd say, piss off, you don't know what you're talking about. And I go, exactly. Now piss off, you don't know what you're talking about.
There it is. Nice.
Yeah, I like it.
Good, good, good. Yeah, we got to
Yeah.
get serious with these people because it's bad. It's bad for the
Yeah.
whole species.
Yeah.
Right.
Yeah.
Can you?
I mean, I don't mind people asking questions, but if I don't think he's actually receptive to the answers.
Right. People are too caught up in feelings.
Which
Again,
my
back to the-
opinions are as good as your facts.
Well,
That's-
back to the 23andMe, right? It's not to glean any kind of real medical evidence. It's so I can carry a lyre around and a shillelagh and act like I'm from Edinburgh. You know,
Well, that's right. I think the best.
I would like to carry a shillelagh around.
I think it's kind of the most unspoken side effect of social media is that we have suddenly become passionate about things that we were never
Yeah.
passionate about.
Yeah.
And once
Yeah.
you have
Politics.
once you have that emotion about anything,
Yeah.
Yeah.
it's so hard to
Uncouple it from
dislodge
logic.
That
Mhm.
yeah.
Well,
difficult.
as someone who's been doing science and health communication now for a decade, what I've realized is that when I have conversations with people and they asking these sort of questions about, let's say, use vaccines as an example, that it's not about the evidence. The evidence has nothing to do with their decision on the matter. If you sit down with them and ask them questions about how they got to that point, you'll find that it is emotionally based or narrative based in that something has happened in their life
Right.
that has led to that point. It could be somebody they love has been affected unfairly or unjustly. Maybe the government did something to hurt them or their family. And so they've got this emotional or narrative issue. It's not the evidence. So this is where, when you have this conversation as a health communicator, you can't just go, here's the evidence. That, like, I hate it when people say the evidence doesn't care about your feelings, because that's not going to change anyone's mind. That's ridiculous. That's such an insane thing to
That's
say.
a
It's
poor
like,
way to have a conversation.
yeah, it's like, okay, now I'm going to double down then if that you're going to speak to me like some condescending prick. You need to engage with somebody as a human being. That's what we do. But for some reason, science and health communicators are like, this is the evidence, so shut up. No, they're not going to shut up. It's insane.
Right.
Yeah. All right, we're getting close to where I have to leave in like 5.
Yeah, let's do one. I think one more and we're good.
Yeah. Let's see. Oh, I hit the wrong button. We have. Let's see. Can you speak to the benefits of how PEMF and red light work? Maybe a little known facts or counterindications. I have both, and I've seen countless times that they do have amazing effects, even surprising ones. Doctors with bone healing, etc. But I'd be really curious what recent research says about this. I don't even know what PEMF
I have no idea what that
is or red light. Do you know what that is, Doc?
I just Googled it. It's pulsed electromagnetic field therapy. So I do know what it is. I just didn't know what the initialism was. So the red light, so basically this is using electromagnetic waves, so light. It's light therapy. And the thought that there are different wavelengths that can affect biology. And there is there's some evidence, some good evidence that this occurs, such as red light. So every light is at a different wavelength, whether it's from the infrared all the way up to, ultraviolet, for example. The red light therapy has shown in certain um, lab-based tests that it can alter the way that the mitochondria works, the way inflammation works, the way certain chemicals are released. I am not as confident or well versed on the evidence as to how good it is clinically in regards to if I were to shine a red light on you for, let's say, wound healing or whatever it might be. Maybe the evidence is good, but I'm not well versed in it, unfortunately.
I know that I've been targeted for red light therapy on my head for my baldness. And there are some caps on Amazon that will charge me $900 for a cap that shoots red light into my skull. And other people will charge $50 for that similar, very similar looking hat to shoot red light into my scalp. Makes me skeptical
Yes.
about both.
Well, I
I
think
do believe
for
that they're
those
basically
ones-
the same
Skeptical?
thing, if it makes you feel better.
Yeah. Or it might be that you need a very, very expensive clinical one that puts the appropriate amount of light on, and that anyone that's sold online probably doesn't have the sufficient amount of light. But again, I'm not well versed on whether it's an appropriate intervention and for what cause.
Okay. Why did I asked you this off air? Well, I'm going to ask it on air. Why did statins make my knees age like 10 years?
Oh, good one.
Why
Thank
did
you.
I go from being able
right.
to play pickleball very well to suddenly taking statins, and now I can't play pickleball anymore?
So there is something called statin-associated muscle symptoms, in which statins have shown to, not for everybody, so this is a side effect that can happen in some people, muscle weakness, cramps, soreness, and so forth. Now, because you're saying it's at your joints, I'm thinking, because there's not a lot of evidence that statins affect joints in any way, but it has shown to affect, for some people, muscles and tendons. So what I'm thinking is that your
I'll
muscles and
notice
tendons
it in
are,
the joints.
yes,
because of
you're
my
noticing it in
activity.
the joints. Yeah, exactly.
Okay.
So I think that it's potentially that is what's happening.
So I have been taking that COQ10 supplement thing, because it's supposed to help with that.
Has it?
I felt it. And maybe if it's anecdotal or not, I have felt it. That and
Okay.
creatine, small
Oh, yeah.
low dose. I've been doing lower doses of creatine.
Oh,
Has been actually helping me feel
lower
much
as
more.
opposed to you were doing higher doses before, or you just
No,
started on
just
lower,
started.
on-
Like I
on
didn't
a
want
low
to do.
dose?
I didn't want to do a lot of creatine because creatine is a water retention
Right.
thing, and then I have a blood pressure issue, so retaining water is a bad idea.
Right.
So I tried these low dose creatine gummies.
Gotcha.
And this supplement that seemed to have helped with my general feeling of being able to walk around, bounce around. That kind
Oh,
of stuff.
nice.
Oh, good.
But am I full of shit? Does it might never matter? Is it
Maybe.
a placebo?
Oh, well, there's good evidence for creatine.
On this show,
good
we
evidence.
never write that possibility off.
There's good evidence for creatine. Its strongest evidence is in weight training and resistance training, because, like you said, you've got creatine, which we get from meat in our food products. Creatine allows for us to regenerate energy in the form of ATP a lot faster. So that's what creatine basically does. You run out of energy less quickly. But like you said, it's got a charge associated with it, so it holds on to water. So that's why when people take creatine, their muscle size gets larger. That's a lot to do with water bulk, and they have more energy, so they can get some more reps done. There is evidence coming out that creatine might be good for other things, such as brain health, for example. But that is not as
New.
I'm not taking it for brain health at the moment.
Gotcha.
They are saying it's at higher doses. And even though for most people creatine is quite safe, I don't think the evidence is strong enough for me to be spending that much money on that much creatine. So I'm waiting and seeing for more creatine evidence for the brain health stuff. I don't know if it's doing anything for your joints. It might be doing something for your energy, but joints wise, I doubt it.
It sounds like what you're saying is that I'm feeling in my joints because that's where like the stress points would be, but in general, I'm feeling muscle side effects from statins. Is that what you're saying?
Yes, the statin-associated muscle symptoms tend to be more in the larger muscle groups, so like the quadriceps, the hamstrings, for example. And so it's probably just manifesting at the joint itself.
Right. But my
Yeah.
ability to bounce or stay low or that kind of stuff it's really just all about the actual larger leg muscles and not necessarily the knees itself.
That's what I'm thinking is happening. But it could also be just a coincidence, and you're getting older and you might actually be getting
What?
age-related joint change. I'm sorry, Matt. I don't know if anyone's ever told you, but you're getting old
It's not-
quicker than
even
most
earlier in
people.
this podcast, you're trying to tell me I was done growing, and I'm sure that I can get a couple inches. I think I can still grow.
Sorry, Matt.
I don't know if we
It's
have
not
enough
happening.
time to do a full intervention with Matt here.
Yes. I don't know if
said
anyone's
that?
told you, but you're decrepit and it's disgusting and it makes us all sick. So,
You know what? You're the second person to tell me today.
The first was his kid.
Dr. Mike, thank you so much for waking up early, taking time
Yes.
to answer all of our questions here from our scoops.
Yes.
We really appreciate it. I'm sure that they'll want to do this again.
Oh, yeah, this was great.
But,
I love doing a very special episode of Ice Cream Social.
I do too, and I thought this would be like a good. It went as great as I thought it would
Yes.
go. We appreciate you taking the time. Again, plug your YouTube channel and your podcast.
Yep. I've got a YouTube channel called Dr. Matt and Dr. Mike, very original, and the podcast, Dr. Matt and Dr. Mike's Medical Podcast. Can I just say I've been a scoop for a decade at least, I would say. How long's your podcast been
We've been
going
going
for?
for a while, but you were one of the first. You and Dr. Matt sent us one of our very first audio jock versus nerds.
That's right.
Which is how
Yes.
we became
Yes.
cohorts.
So I've been listening to you guys for a long, long time. So I love all three of you, and I love being a scoop. So I'm happy to do this anytime. I hope it helps. I hope I didn't talk too much.
Oh, definitely.
So
No,
thank
thank
you
you
guys.
so
Sooner
much.
than
Came
later
on here to
next
talk.
time.
We made you.
We
talk.
gotta have you
Don't-
on
Do
again
not feel
very
bad about
soon.
talking.
Yes.
That's why that's why we put you on here.
Yeah.
Thank
That's
you
what we
guys.
wanted. This was fantastic.
Very much appreciated.
Yes,
Very much
thank
appreciated.
you, pal.
Mhm.
And yeah, check out his podcast. Check out his podcast and his YouTube channel.
Do it. Do it. And thank you to Penn for creating this whole fucking podcast. Thanks,
Yeah.
Penn Gillette. And we got some other people we want to thank right now.
Yes, I want to thank the following people here, Doctor. If you have to run, go for it.
We're gonna thank people, Doc. If you wanna head out, or you can stick around. You do you.
I want to thank the following people here, who all wait.
He did want to head out, by the way. He wanted to leave.
He probably should go back to bed.
Yeah, exactly. Sleep time.
All these people also think blood pressure meters are fucking bullshit. Kurt Engelman, Brian McLeod, Polygon, our cat's Dunn, who asked a lot of great questions here today. David Lang, Scoop Paul's Drag Race, Patented Phil, Ben Mack, Alyssa Christine, Ben and Ellen, Patrick Gibbons, Kenny, and Avon Zarlez. Thank you so much.
Big thanks to all these individuals who are hard up for that kratom. Monadnock Scoop, Jason Wingarden, Tanya Knapp, Canadian Scoop Crystal, Adam Stickney, Kim Atchison, Scoopiter Ascending, Carl Unsach, Ron Bowes, Eric Hall, Barbara Gilroy, Scott Ashlock, and Sherry Hare.
The following scoops, they all know that they need to get that cholesterol checked. That's Alan Bennett, Linda Brandmere, Joel Davidson, Ed Wagner, Chris Ducher, I think so, Fiona Skilling, Chris Mayer, Bill Newton, Jeff Libby. New book, The Greatest Gift of All, A Reasonable Path from Religion to Humanism by Mark McLean, out December 30th. Pre-order now. Rochelle Millet, Ben Gow, Daniel Greenwolf, and William McDonald.
All right. The following people are all psyched to find out they're related to Cleopatra. David Lemons, Walker Fluke, Scoop of Saltwater, Logan M. Swanger, Girl Dad Scoop, Sherry Phillips, Randy Glenn, Lee Drummond, Jeff Loomis, Kevin Chamberlain, Mark Gates, Stuart Boyer, Juan Galaviz, and Mark Schultz. Thank you so much.
Big thanks to all these folks who are the new spokespeople for that truck stop strawberry estrogen vape. John Holchin, Steve Verne, the Bad Humor Man, Justin Hartel, AJB, Matthew Neer, Connor Hack, Carl Unsach, Latter-day Scoop, Trista Petty, Watto, Elizabeth A. White, Deb Tittle, 911 Scoop, and Nate Wallach. Thank you.
And the following scoop sent a sample of their blood off to 24andMe. That's Stephen Eames, Ryan Meeks, Cecil Young, Sir Chomps, Wes Coughlin, Lance Amon. Let's see. Kay Mathis, Edward Bender, Max the Ginger Scoop, John Jacob Schuppenheimer Schmidt, Unalaska. I like it. Justine Scoopa, Karma, and Sonia Petrovich. Thank you all so much.
Thank you. If you want to be thanked on air, if you want a bunch of other rewards that we offer, if you want to support this podcast because you think it's worth more than $0 in your life, please head over to preachingfun.com and select your tier today.
Come visit preachingfun.com.
Or if every time you fart into a bag, I think, boy, that's one less colonoscopy I have to get, go to fartsinabag.biz.
Farts, 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 farts.
Don't take medical advice from a podcast. That's fartsinabag.biz. That along with preachingfun.com. It takes you over to our Patreon page where for as little as $3 a month, you can help keep this show on the air. We are dependent on you, our Patreon supporters. So please, if you think this show is worth more than $0, preachingfun.com, fartsinabag.biz. Those are the places you can go to sign up. And it's as little as $3 a month. We have a very low Patreon level, so $3 a month, it keeps this show happening, is truly what it does. And so thank you to everybody who supports us at any level over there at patreon.com/heyscoops. Way too long of an email address, preachingfun.com, fartsinabag.biz.
All right. Thanks for listening, everybody. Stay safe out there. We love you, and we'll see you soon.
We'll see you soon.
Be a better self-advocate.
Thank you again, Dr. Mike.
Yes, thank you, Dr. Mike.
That was awesome.
That was so good.
And thank you, Scoops, for sending in some really wonderful questions.
Absolutely.
Got a nice range.
We're preaching fun. Me and Frank Thomas. See ya.
Thanks, all.
Big hurt. Low
Thank
T.
you, everybody.
Thanks, gang. Really appreciate y'all being here.
Thank you so much. Twitch, we'll see you
Have a
next
great rest of your week.
Wednesday. We'll see you in a week. We're not in on Friday, but we'll see you on Wednesday. We love